Let me turn the program over to Dr. Kevin Churchwell, who is the president and CEO of the Boston Children's Hospital, and he'll be sharing the state of children's behavioral health care with us. Dr. Churchwell is a longtime leader and advocate in the world of pediatric health care and has led one of the world's most prestigious children's hospitals through the COVID pandemic, mental health crisis, and more. Dr. Churchwell.
Well, we've got a full house almost. This is wonderful. Thank you. So I want to start by just thanking our host, Rick Page of the Boston Bar Association. Thank you for the opportunity to have this place for us to get together and have some time to really talk about, I think, one of the most important issues that's facing us today. You'll notice I never say problems. I say issues or challenges. I don't believe that we have problems. That's just me, okay, as we go forward. I also want to thank our MC, Jackie Anderson of Blue Cross Blue Shield Foundation. Thank you so much for sort of helping and leading us through this day. Before I start, I also want to make sure that I go on to Steve's comments around the work that's happening in our hospitals. And thank you so much, Steve, for your comments around what's happening at Boston Children's. But I also wanted just to point out that the work is happening all across the state in many great institutions that are working every single day to deal with the challenges that we have. You talked about Joe Mitchell and the work that's happening at Franciscans, but I also, Dr. Assad made it today from Cambridge Health Alliance, and the work that he's leading is just phenomenal and just incredible in terms of being at the forefront for our kids with behavioral health issues. So thank you, Dr. Assad, for coming today. I just had an opportunity to talk with one of our colleagues that works at Tufts and our partnership with Tufts in terms of the ER and what's happening there. And then just across the state in terms of what's happening at South Coast or UMass, Bay State, what's happening at Boston Medical Center. I'm going to leave somebody out, but I just want to just make the point that it's happening all across the state, and we're working in a collaborative way through MHA to help us coordinate our response to one of the most important issues that we're facing today. So thank you, Steve. You know, the work that you're leading to capture the behavioral health crisis, including gathering and publishing statewide data on the number of children boarding across our state on a weekly basis, continues to provide us with essential information to assess needs, allocate resources. It's also continued to remind us all, not just those of us in healthcare, that more needs to be done. Steve, you've also been a critical voice for the healthcare workforce, a workforce that has been on the front lines of children's behavioral health crisis. Your work with the Massachusetts Association of Behavioral Health Systems to survey the field on workforce shortages once again made the case loud and clear. We must invest in a robust and culturally responsive workforce. So I'm privileged today to lead an outstanding organization dedicated to the health and well-being of children. I'm also privileged to be with all of you today to discuss how to comprehensively and in collaboration address the growing behavioral health needs of our children. It's great to see such a broad and diverse group of behavioral health leaders, experts, providers, advocates, public officials, and many others here today. I'm particularly glad to see people from across a variety of sectors, such as the Department of Children and Families and the Department of Elementary and Secondary Education, all dedicated to the behavioral health of our children. As a doctor, I tend to see the world through the lens of delivering medical care. I appreciate and look forward to hearing other perspectives that many of you will share today. As we discuss how to better address the behavioral health crisis, I would ask all of you to keep that in mind, that children are different from adults. I'll say that one more time. Children are different from adults, not just because they're smaller, okay? And they rely on a different system of care that we have to evolve and develop. I want to thank and commend everyone in this room for your deep commitment and many contributions to the behavioral health and well-being of our children. I want to recognize up front the enormous amount of good and effective work all of you have done. Thank you all. While a great deal of work has been done, we still have a behavioral health crisis. The pain point in this crisis we see every day is boarding. We don't have enough capacity in our emergency departments, and we don't have enough inpatient psychiatric beds. But the behavioral health crisis is much broader and much more complex than just the boarding crisis. We could solve the boarding crisis and not solve the behavioral health crisis. But solving the behavioral health crisis will solve the boarding crisis. I'll say that again. Solving the behavioral crisis will solve the boarding crisis. Part of the solution must be talking and thinking differently about behavioral health and recognizing how broad and complex the crisis is. There are many different individual diagnoses under the behavioral health label, particularly for kids. As we imagine a better system, we must keep in mind that there is a wide range of needs. It's not a matter of one solution for one problem. We need to develop a variety of solutions to address the range of problems we are encountering. Looking ahead, I believe our focus should be on, one, accelerating implementation of solutions that work, building a culture of quality improvement, improving delivery efficiency of those solutions, and also, importantly, creating a culture of innovation. We need to imagine a future where children and families experience the behavioral health system the same way we experience the medical system when it's functioning at its best. And I'm not saying the medical system functions all the time at its best. I wouldn't say that. But we know that there is the opportunity, and we've seen the medical function at an incredible level. And so the goal would be to create the experience for our behavioral health kids and the behavioral health system that functions in that same way. With strong and supportive guides, expertise that is easy to access when complexity arises, and a continuity of care for what is often a chronic condition. We all know many of the ingredients that will go into an improved behavioral health delivery system. I'm concerned that if we do not have them in the right proportion, mix them well, and work hard to keep adjusting and improving our recipe, we're not going to deliver the improvements we are all committed to deliver. Throughout today, each panel will discuss a topic where we have room to improve. I'm looking forward to working with all of you and being part of a team that reimagines a better system and implements reforms and opportunities necessary to proactively meet the behavioral health needs of our children. You know, it's been 1 year ago this month that the Children's Hospital Association and the American Academy of Pediatrics declared the behavioral health crisis a national emergency. Thank you. As all of you know all too well, a number of factors over the years allowed a worsening problem to become a crisis. You know, a lack of societal understanding of the magnitude and severity of the problem, a failure to prioritize behavioral health due to stigma, a pandemic that greatly exacerbated the problem, and that's important to truly stress. And also, perhaps most damaging, a long-standing underinvestment in our kids, in our children's behavioral health needs. There has also been a lack of understanding that access to behavioral health is needed throughout the continuum of care, not just in traditional medical settings. Children need access in their homes, schools, and communities. In this context, acute care has become the default safety net, leading to increased rates of psychiatric boarding among children in emergency departments and in medical surgical units. In the 4 years leading up to this pandemic, Boston Children saw a 61% increase in psychiatric boarding. Currently, anywhere between 40 and 50 kids are boarding in our emergency department or on medical units awaiting psychiatric care. So I want to recognize the thoughtful planning efforts that have occurred and acknowledge the implementation that is underway. But I think we would all agree there is more that we need to do. As all of you know all too well, the current system is simply not working for our children and families. We all know the components required to build a better system. The challenge is how to fund and coordinate those components. Reimbursement for behavioral health services is low when compared to other services, and this has been a problem for quite a period of time. We also know that many of the behavioral health services we do provide are not even covered by insurance. And some of the administrative hurdles associated with actually getting paid for behavioral health service when it covered can be truly problematic. I'm particularly concerned about our most vulnerable children. We know that structural racism and inequities exist in our behavioral health care system. Every child should have the same access to care. I'll say that again. Every child should have the same access to care, irrespective of their zip code, race, or gender. Our research, our workforce, our care, and our innovation should reflect the needs of all of our children. That includes children in state custody, children in our inner cities, and children in rural communities. So going forward, we must together work more effectively to address the crisis and better serve our children and families. So first, we must implement recent policy successes, especially ARPA, ABC, and the roadmap, to achieve parity, pay for treatment providers to boarders, and reduce the silos that we see every day. We must develop a comprehensive approach that includes making substantial investments in the full continuum of care. In particular, we must ensure that children can access the Department of Mental Health continuing care placement, and that the Department of Children and Families residential settings have the care competencies that they need. If we can do this, we can avoid bottlenecks in our system of care. Some of our inpatient units have had children there for more than a year without a place to go, without a true plan for care. In addition, we must invest more in developing a diverse workforce, including workforce extender models like the Massachusetts Child Psychiatry Access Program, which enables children to remain in their homes, schools, and communities. That's where the solutions truly lie. We must also invest more in research. Despite the high prevalence of behavioral and mental health disorders among young people, the underlying causes are still poorly understood. Researchers at Boston Children's and elsewhere are investigating the most complicated and debilitating behavioral and mental health conditions so that we can create new, more effective therapies. However, we will not be able to develop long-term solutions to behavioral health crisis if we continue to underinvest in research. Sustained investment in children yields impressive results and returns. One of the most impressive examples is in the Education Reform Initiative, launched by the state of Massachusetts in the 1990s. Today, the academic performance of Massachusetts students is consistently among the highest in the nation, thanks in large part to the sustained investment made in education reform. So we can't solve this problem alone. We need strong partnerships with federal and state government, providers, payers, and schools. I know many of you have been following our proposed affiliation with Franciscan Children's. Our affiliation is an investment not just in the present, but in the future, one that will better serve children, families, communities, and employees in our hospitals. We believe that to be the case. It will help address many of the challenges I've cited, including more accessible and better coordinated care among the continuum of care, workforce development, the idea that we have the opportunity to create a nidus and a campus where the next generation of caregivers, psychiatrists, psychologists, nurses, nurse practitioners, social workers, have the ability to be educated, to learn, and develop. And that's something I think is truly exciting. Where research will happen, the next evolution of research for the care of our children with behavioral health issues will be part of that campus. So I believe our affiliation with Franciscans as a way for us to be part of the solution, part of the continuum of care. We're not promising that it will be the entire solution, right? Because there are multiple parts that will be part of that solution, the part of that continuum of care. But we believe that our work with Franciscans will be part of that continuum. So in closing, I want to thank you all again for all that you have done and all that you will do to address the behavioral health needs of our children. We all have done a great deal of work over the years, but the current crisis, the current issues, the current challenges that we're facing demand that going forward we do more together in a more integrated, coordinated way. Together we must harness the collective experience, expertise, and commitment in this room to address not only the current crisis, but also the long-standing systemic issues rooted in a lack of understanding and support. And that's where the great opportunity is, not just to deal with what the present is describing to us, the present issues, but also the future, a future that we can develop for our kids with these issues, with behavioral health issues. We have a window of opportunity to make significant positive change, and we must not miss it. I'm confident that working together we can and will design and drive improvements and reforms that will help build a better system and a better future for our children and families. So I look forward to working with all of you to build that future. Thank you.
Thank you, Dr. Churchwell. And, you know, Dr. Churchwell gave us a call to action, right? He started off saying that basically children are different than adults, and we need to develop systems and processes and infrastructure to support their development. And so our call to action to each of us is really about how do we collaborate, work together, whether it's on research, whether it's on individual practices to make a better system for kids.